we talking about today? Yeah. I'm going to be talking a little bit about the war on drugs, more from an international perspective. And so we had done, I think one of our last presentations was all about the war on drugs. Actually, the April session was all about the war on drugs domestically, and really how, really since like the early sort of turn of the century, we've sort of embraced and seen a lot of propaganda, copganda, as I think the new term is today, around sort of racializing drug use in a lot of ways, but also developing policies that are really targeting minoritized and racialized groups of people through this loose association with drug use, right? And so unsurprisingly, a lot of these sort of domestic policies have very heavily influenced the sort of international arena, especially as it relates to drug use. And so we're going to talk a little bit about that today. So hopefully you all know that, drug use is a commonplace all around the world, and back through millennia, that we have sort of historical record of, all the way back to like 6,000 to 8,000 BCE. And we sort of see this obviously as a universal human experience, right? We are, as humans, we will find ways to alter our mood or consciousness through techniques. You can think of like holotropic breathing, like quick breathing exercises and things like that, or through substances. And oftentimes these have been sort of associated with ritual when we look at it a little bit more historically as well. But these are just some sort of the big things that we see. And I like some of these examples around here as well, pointing out some of the different types of psychedelics, especially, but also some of the prevalence of different types of fermentation products like beers, wines, meads, things like that throughout the world. And what we know, I think really what we dove into our last session was that we know that drug laws often are not representative of the actual drug harms. And so I'll come back to this picture in a moment, but I like this sort of graphic here that equates a lot of these sort of levels of harm to the levels of control if we look at the United Nations classification of drugs. And so interestingly, you can see that this is all jumbled up, sort of that the levels of harm are not always equal to the levels of control, especially at the international, national level. And so we're going to dive a lot more into that and about why some of those policies have taken place. But again, we're also going to sort of talk a little bit about some of the cultivation histories of these different areas of the world. And so anywhere from Indian Sidhus who are using cannabis, which was the sort of holy plant of the Ganges River, where the word ganja comes from, who've used this again for millennia, to Northern Africa, where we see the first depictions of like psychedelic mushroom use around 8,000 years ago in sort of cave drawings of this mushroom man. And also what we will talk a little bit more about is the Cocalero movement as well, and sort of this indigenous-based movement to really talk about this history of cultivating coca leaves for later production, but also just sort of as cultural practice as well. Another piece of this to think about, though, too, is that as specific nation states are pressured to develop responses to drug use, often from international sort of pressures and things like that, what we see is this thing that what they call a balloon effect. And so if there's going to be higher interdiction and supply interventions on opium and poppy plants in Afghanistan, we might see a sort of resurgence and boosting of cultivation and supply in countries like Myanmar. And so we see that with cocaine production in Bolivia through Colombia, and sort of this constant sort of supply reduction increase happening in regions of the world that are able to cultivate a lot of these substances. So I'm just going to only go to the turn of the century. There is a lot here, and I couldn't even jump into a lot of the sort of Central American movements as well, but we'll get to that in a bit. But looking back to the first sort of international drug conventions, this was the 1909 International Opium Convention, and then later the 1912 Hague Opium Convention, which were actually primarily made up of member states that were colonial powers, right? And so I'm not more talking about the neo-colonial powers in the United States, but more of like the Dutch, who were controlling cocaine and opium production around like the Dutch East Indies, the British in China, East China opium wars, but also the Portuguese, who were cultivating drugs, and also Germans and Austrians, who later were also essentially the sort of holders of massive pharmaceutical companies, right? And then a lot of these large international pharmaceutical companies were based in these colonial powers, who had direct interest in not regulating and not reducing the supply of a lot of these substances so they could create medications and things like that. I like this quote from Walter Lippmann, who was an advisor to Woodrow Wilson near the earlier part of the century, but sort of in conversation about some of these conventions, he said that to the amazement of the older nations of the earth, and he's specifically talking about the colonial powers there, we've enacted new legal prohibitions against the oldest vices of man. We have achieved a body of statutory laws which testifies unreservedly to our aspiration for an absolutely blameless life on earth. And so we really saw that tension in 1925 with this United States and China who had, as a country, had really seen a lot of sort of exploitation from, again, these colonial powers, and had deep interests in reducing opium supplies. We saw this tension, though, United States obviously going through its own sort of cultural prohibition movement as well, interest in reducing the supply of drugs around the world. But there were only, I think, 12 or 13 countries, again, at these conferences and conventions that they weren't really able to move anywhere. The United States did not have, at that time, that global reach and sort of hegemony around sort of the drug policy sphere. And so they weren't able to move necessarily forward on major supply reduction, demand reduction sort of policies internationally. But when we look at after World War II, the United States is, I think, emerged as this sort of larger global military power. I say the flexing began. And so we look, although there were some conventions, obviously, in the late 40s, 50s, most interesting, I think, is sort of the United Nations, newly created within the last decade and a half. The Single Convention in 1961, which really started what we see as sort of modern scheduling of drugs. And so these are the drugs that have no benefit to society. These might have some medical purposes. And really, we see more language around we were only going to be supporting the production of drugs that have some sort of medical or scientific research purpose, right? And so this is really, again, staging the ground for abolition. And then these new scheduling classifications were sort of solidified in 1971 at the Convention on Psychotropic Substances. So it's essential, right? With all of this happening, right? The United States is obviously interested in drug supplies that are coming to the United States for a variety of different reasons. And what we see is really, there's no justice to be able to cover all of the stuff that happened during this time, but American interdiction and supply reduction efforts in Central and South America through CIA and some DEA-driven sort of policies around and operations like Operation Intercept, in Mexico, Operation Just Cause, terrible names in my opinion, but Plan Colombia, and then also aerial herbicide application, which I'll talk a little bit about in this human rights impact piece, where as a result of a lot of these efforts and increased sort of militarization, we're seeing now forced displacement of many communities, both from non-government actors who are supporting the cultivation and refining and distribution of some of these substances, but also increased militarization of indigenous people's lands and increased funding going into national governments that may have not had human rights in their best interest at the time as well, and all certainly encouraged by U.S. foreign policy at the time. So we have militarization of indigenous people's lands, criminalization and impacts on women and children who are often taking on the roles of cultivators and also traffickers through, sort of separation of interest in the sort of labor market as well. And so obviously finding ways to create an income, at any opportunity you can have. And also with, specifically the aerial herbicide application, these are again flying over what are areas known to be drug cultivation areas and they're just sending herbicides that kill everything. But this is also obviously impacting communities and families and individuals, subsistence farming activities, huge impact on sort of safer food supply and everything. Interestingly in this, and I think that as we'll talk about with more modern international drug policy communities, I want to at least highlight the Cocalero movement in Bolivia specifically, which actually saw the rise of Prime Minister of Bolivia, Evo Morales, who came from a Cocalero background. But the Cocalero movement was essentially, again, an indigenous-driven movement of people who were long for, again, centuries and millennia cultivating the coca plant, and all saying that this is our right. This is what we've been doing long before we've had these supply reduction policies that have been devastating our communities. And so we see that elevation not only at a national level, but later at an international level, especially within the United Nations. I really appreciate this quote from the Executive Secretary of the United Nations Economic Commission for Latin America and the Caribbean. Who would drug legalization be good for? Latin America and the Caribbean, for God's sakes. Because the illegality is what's killing people, it's time to seriously consider legalizing drugs. And again, what are the sort of the negative consequences of these policies? And again, this being some of these human rights impacts. So international dialogue today, right? The United Nations Office on Drug and Crime was created in the late 90s, early 2000s with a fusion of a couple of different offices. But it's really interesting in that while programs such as like UN AIDS, which is obviously looking at like HIV and AIDS, and other offices and missions are able to talk about interventions that we've talked about previously, like harm reduction or opioid substitution therapy. Interestingly, the United Nations Office on Drugs and Crime is muted in a lot of ways because it's a very pivotal committee and organization that I think is really seeing the convergence of indigenous community concerns, nations that have taken different approaches other than supply reduction and demand reduction activities, more evidence-based approaches like harm reduction or opioid substitution therapy, things like that. And then United States policy, which is very, has been at times very threatening of a lot of nations for even, I think, elevating some of these larger concerns to the international community. And so really so UNODC runs, in theory, every 10 years, this United Nations General Assembly special session, UNGAS, which is not a very flattering name, but on drugs, which is bringing together, again, civil society, public and private sector interests. And again, this is going to be that space for a lot of our indigenous communities to be elevating some of their concerns outside of the control of their national government, which may not always have their best interests in mind, especially on the international stage. But in a lot of ways, it's finding unique and creative ways to address and unpack failed prohibitionist approaches in a lot of ways. And so there's a lot of coded language in some of these sessions, but their sort of goal here is to address demand reduction, supply reduction, human rights issues, new threats and challenges, and then I think more recently is this sort of alternative development. And this is where we see with the United Nations development goals that they've put out, I think for 2025, that we see more actually conversations about protecting the rights of cultivators, indigenous cultivators and groups that have long, again, been able to use a lot of these substances and medicines prior to some of these efforts. But what we're really looking at as well, and this is from the Global Commission on Drug Policy, is the spectrum. And I would have loved to plot some countries here, but maybe we'll sort of be able to talk about that in the discussion. But in these large conventions and special sessions hosted by the United Nations, we're seeing a wide range of nations and regional groups that have taken on different approaches towards regulation of substances. And I like this graphic just because I think I've showed it in the past, but it sort of relates harms, both social and individual health, to the level of drug regulation, anything from prohibition to decriminalization and harm reduction, which is where I think the United States would probably be somewhere between that prohibition, decrim section. But also responsible legal regulation, lax regulation, and then unrestricted access, which we really don't see necessarily a lot of that internationally. But, you can imagine, when we have a high prohibition level, we're going to see a high unregulated criminal market. And I think there's a lot of interest, especially when we're talking about international political approaches to drug use. When we're talking about large, crime syndicates, we're talking about Italian mafia, we're talking about different groups in Colombia and Central America, cartels, that kind of thing that comes to mind, where we see, again, the argument being that with prohibition, without a way to safely access these things, that these criminal groups are able to then essentially profit off of that. And there's a huge market for it, right? And especially when it's completely unregulated. The argument, though, is that with more regulation, the more that we can actually regulate this, where the supply is coming from, and that we're not then funding directly a lot of these more potentially violent organizations. So the international harm reduction community is where we sort of come in with this now, and is really pushing for measuring the sort of global situation of drug use through these different metrics of progress. And so they look at 7 different metrics, which is, does the nation have explicit supportive reference to harm reduction in their national policy? Does the nation have at least one needle and syringe service program operational? Do they have at least one opioid substitution program operational? Do they have at least one authorized drug consumption program operational? Do they have at least one naloxone peer distribution program operational? Do they have an opioid substitution treatment program in at least one prison? And do they have a syringe service program in at least one prison? So we can sort of see what this looks like internationally. This is just looking at the availability of syringe service programs in the community and in prisons. And so the prison piece is actually really new, especially in the last 2 decades, where there's an open recognition that substance use happens in prisons, right? And we know from data that drugs are still entering prisons. There's often a lot of even injection drug use. And so oftentimes, especially here in the United States, individuals will be tested for communicable diseases like HIV and hepatitis C on entry, but they won't be tested on exit. And there's a lot of criticism around that, being that they're not recognizing that or acknowledging that transmission may be actually happening in the prison, either through sexual contact or through like the sharing of needles and things like that. And so you can kind of see, some of the more interesting ones I think are, I don't know if you can see my cursor, I think not though, but some of the Central Asian, Kyrgyzstan, in Southeast Central Asia, we even have, countries like Moldova or Macedonia that are kind of at their wits' end, in a lot of ways, that have wanted to incorporate some of these programs into prisons. But we see large gaps, right? Obviously, South America, West Central Africa, Northern Africa are, I think, finding ways to catch up. But we do see a lot of really exciting movements in Southeast Sub-Saharan Africa as well. The other piece, interestingly, just looking at the global availability of opioid substitution therapy in the community and prisons. This is also sort of interesting because it's more of this treatment-focused approach. And so we see these types of programs actually happening in the United States, and actually a lot more around the world. And interestingly, one of the first countries to really push forward on this was the Islamic Republic of Iran. And they've partially because they saw this transition during the revolution from being a opium sort of cultivator, but with the sort of Islamic Revolution, absolutely, that was shut down. It was met with very harsh penalties, death penalty for trafficking, and also like even minor mid-level possession. And we saw a lot of that cultivation then transfer to Afghanistan. Iran then sort of transferred though into a what we call like a transfer state, and so a transit state rather. And so they were seeing now higher process level of opium into things like heroin from producers in Afghanistan. And so they really in the last couple of decades have had to respond with a less sort of draconian or punishment-based model, and have been implementing a lot of these programs into prison, reintegration programs and things like that. So I just want to give sort of a big example here. We talked a little bit in our last conversation about the 4 pillars model in Switzerland and some of the things that some countries are doing around like heroin assisted therapies. But I wanted to highlight Portugal because they, from the sort of perspective of when the countries were really, really needing to address some of these, the HIV transmission needs. We're right now 15 years into this new HIV epidemic by the late 1990s. And so there was a lot of sort of comparison of different national policies around, what were countries doing to address some of these needs. And so in the late 1990s, Portugal faced the highest rates of HIV amongst people who are injecting drugs and also overdose. And so, they were wanting to do something drastic. It was actually a lower to middle income per capita country at the time as well. And so they were trying to address several different things at the time. And so in 2000, the country implemented some of these drastic new policies, which included across the board decriminalization of all drugs. And then they also included these, I love this, dissuasion committees, which is, I think, a little bit more of an evidence-based version of our American drug court system, that essentially it's a drug court that has no connection to like their penal or carceral system. And so if somebody's messing up, they're not going to be facing that threat of going to jail. But they had like committees and groups, sort of specialized teams of individuals from housing backgrounds, from public health backgrounds, from drug treatment backgrounds, to meet with these individuals to, again, address sort of this whole person need, right? They also issued drug possession waivers to people who were habitually getting arrested for drug possession, and maybe larger amounts as well. And so they were allowed essentially to sort of move by without having to go about their life without having to interact with a lot of these law enforcement systems, which may at different times have been under different levels of oversight and accountability. Obviously bolstering some of these harm reduction efforts, syringe service programs that had already started in the early 1990s were expanded across the country. And then also, I think what is so important and what I think are really lacking in a lot of ways here in the United States is really intentional efforts for aftercare and then social reintegration. And I think that sort of explains itself, but really finding, again, these ways that we can provide housing first, have continuous check-ins with people who might have had past of substance use disorder. So what did we see, right? Comparing 1999 to 2016, you can see sort of pretty drastic, just on pure numbers, differences in overdose deaths, new HIV diagnoses due to injecting, and then a number of people incarcerated for drug offenses as well. I really like this quote, though. This was the architect of Portugal's decriminalization policy. He said, "It's very difficult to identify a causal link between decriminalization by itself and the positive tendencies we've seen. It's a total package. The biggest effect has been to allow the stigma of drug addiction to fall, to let people speak clearly and to pursue professional help without fear." And so what I think is so important in that is, again, sort of this cultural shift that has come with some of these policies. And I think, again, when we think about a socio-ecological model, the importance of shifting policies in changing people's perceptions of a social issue. And this is sort of a great example of a country that's done that. So this is sort of I added this in kind of last minute because I'm still interested in it. I have a lot more research to do, but I wanted to at least talk a little bit about transnational crypto markets, because I think that this is really changing our conversation around gangs, cartels, mafia, drug crime that is really syndicated and within sort of centralized families. So we see now with, I was trying to count how many different crypto markets. And so essentially a crypto market is a way to use cryptocurrency like a Bitcoin or Elusium, things like that are, again, sort of anonymized payments that people can make to purchase drugs, like all of these things listed here. And you generally have them safely delivered to their house, right? And so it's sort of in a lot of ways, very Ayn Randian sort of capitalist dream of taking away drug control policy, but then allowing sort of these capitalist markets to regulate themselves based off of supplier reviews and that kind of thing. But I think it's very interesting because we are seeing a rapid diversification in the types of drugs available. It's really easy to get things like fentanyl to then cut into drugs. And again, we know that from previous conversations that fentanyl is going to probably be a little bit easier to transfer versus large amounts of like heroin or opium, smaller the better sort of thing. And so we do see this decentralization of trafficking operations. People who are utilizing these services talk about the ease of use and also a perceived increase of safety, quality of product, and then the ease of delivery. And these are anonymous packages delivering to people. And so I think that the international community is obviously trying to catch up with this. And so I'll be really curious to see what we see in the next Ungassed session about sort of transnational crypto markets.